I like being a part of collaborative network because one single project doesn't change much. But as a team, we actually have a chance to make a difference.
Did you know that patients with diabetes have a 2 to 6-fold higher risk of bone fractures than people without diabetes of the same age? Since diabetes, especially type 2, affects over 10% of the population worldwide, diabetic bone disease is becoming an emerging health hazard.
Patients with diabetes mellitus experience a variety of medical complications, including a higher risk for bone fractures.
Fidelio is an innovative training network that is funded by the European Commission, and these training networks are designed for PhD students to receive optimal training in a specific topic. Our aim is to identify how diabetes affects bone health and how we can identify patients at risk for fractures. As these questions are very complex, we put together an interdisciplinary team of researchers composed of medical doctors, epidemiologists, geneticists, engineers, and molecular biologists to jointly work together and approach these questions from multiple angles. Within Fidelio, we have 14 early career stage researchers from all across Europe. Each one of them has their own specific project that deals with a distinct aspect of diabetic bone disease. They use various approaches to do so. Some investigate the molecular mechanisms of diabetic bone disease and do so by performing lab experiments. Others use data-driven approaches to study the interconnection between diabetes and bone fragility using patient cohorts.
Hi, I'm Ankita Duseja from the United Kingdom, and I'm interested in identifying different molecules present in the blood, in particular microRNAs, to understand why patients with diabetes have an increased fracture risk.
Hi, my name's Sam from Erasmus Medical Centre. Our DNA contains over 3 billion base pairs, and my project uses big data to explore how changes in our DNA can affect bone fragility and type 2 diabetes.
Hello, I'm Mohammed from the University of Southern Denmark. As an epidemiologist, I'm analyzing big data sets to describe the trends of fractures in diabetic patients and to investigate if there is an association between fractures and complications of diabetes.
Together, our project aims to answer the question of bone disease in diabetes. This is done through collaborations, sharing knowledge and data.
It is a pleasure to work with so many young, motivated students, and we do hope that they will get a broad education within the Fidelio program, and we hope to uncover novel mechanisms of diabetic bone disease and bring our translational findings to the patients ultimately.